Of the presentation is gender differences in hospital management of patients with acute myocardial infarction in Kosovo. Please.
Dear Chairman, thank you for the opportunity to present my study here. I come from Kosovo and I will talk about the results of our study regarding the gender differences in hospital management of patients with acute myocardial infarction in Kosovo. Myocardial infarction is a minor cause of mortality among women. A systematic evaluation of the quality of care in women hospitalized for acute myocardial infarction remains lacking in Kosovo, and actually this is the first study that the first results of this study I will show here. And the objective of this study was to assess gender differences in hospital management and outcomes of patients with myocardial infarction in Kosovo. This is a cross-sectional descriptive study conducted at the Clinic of Cardiology of the University Clinical Center of Kosovo in Pristina as the only public tertiary health care center, which included all patients hospitalized for myocardial infarction in a period of time over 7 years, from 2014 to the end of 2020. And we studied all coming patients with acute myocardial infarction, and among 7,353 admitted patients with myocardial infarction with a mean age of 63 years, only 29% of them were female. And according to the discharge lists, there were 59% of them had STEMI, and just 41% had non-STEMI. In hospital mortality of the patients group as a whole that were not transferred to another 24 hours primary PCI center was 10.6%, and it was significantly higher in patients with STEMI compared to non-STEMI, with 13.2% versus 7.2%. Women with acute myocardial infarction were older than men, were less smokers, more diabetics, more hypertensive, had higher level of glycemia, higher cholesterol level, lower hemoglobin level, and higher heart rate at admission compared to men. However, women received less coronary angiography, 59% versus 71%, and primary PCI 44% versus 53% compared to men. Women had less STEMI compared and suffered more cardiogenic shock and had higher mortality rate, 13.6% versus 7%. This is compared to men. This is the extremely high difference regarding the mortality in patients in women compared to men. And as a conclusion, women hospitalized for myocardial infarction in Kosovo were older, less smokers, more diabetics and hypertensives, had higher cholesterol level, lower hemoglobin, and higher heart rate at admission compared to men. Women were less likely to receive evidence-based acute treatments for myocardial infarction, such as primary PCI, than men, and they had higher rate of cardiogenic shock and higher rate of death. Thank you very much.
Thank you very much. Thank you.
Any questions from the audience? If not, I have a simple question. What do you think? What is the reason for this gender difference, especially for referring to coronary angiography, despite the women have even more cardiogenic shock at the presentation, as I understand?
I discussed these days also with my colleagues from Kosovo here, and we really couldn't realize to find the exact reason of that. Even the mortality rate of women in all other countries is a bit higher, but not with such huge difference. But I think that social, economic, and traditional factors are mainly that made this difference a bit wider than in other countries.
Yeah, but what is difficult to me understand why the patient that arrived to the hospital and we don't have to think about the female and male receive less invasive strategy than the other one.
Yeah, very important question for the people that do not know the exact situation in Kosovo, because this study included the patients that were before we started 24 hours per day, 7 days per week, invasive treatment. That was 2018, and before all that, some patients we transferred to another center, some refused, some it was also the insurance method, and also there is a sample of patients that refused invasive treatment also.
Sounds reasonable. Thank you very much.
Thanks a lot.